Welcome back to my channel. My name is Amanda, owner of AusetHerbals.com, an online herbal apothecary focused on womb healing and services. In this video, I wanted to give my top 10 tips as a doula for prenatal, birth, and postpartum. Alright, so let's get started. Number one doula tip for prenatal: assembling your support team. And if you do not have a support team, or you feel like you don't know anyone, you don't have anyone, I encourage you to ask your creator, ask the universe to not only support you, but to bring the support in the form of people, and know and trust that it will be provided for you. Okay. Second doula tip for prenatal is definitely stretching and squatting all day, every single day. You want to prepare your pelvic area, you want to prepare your legs, your lower body has to be strong for birth, okay? Number 3 for prenatal doula tip: you have to act like you are going to be running a marathon in 9 months. So think about how athletes prepare for marathons or for their games or whatever. This is how you need to think for the 9 months leading up to your birth. Number 4 on the prenatal doula tips is drinking a lot of water. You must stay hydrated. Also, eating the rainbow. You want to make sure you get all of your nutrients, especially during the 9 months before your birth, so that you can have an easy birth. Some of the things you want to focus on as far as eating are foods that will help you have a healthy GI tract, so a healthy gut. So you want to eat a lot of foods that are good prebiotics and probiotics. You want to eat things with fish oil, such as salmon. And a nice trick is to, at least 4 weeks before your due date, you want to eat 6 dates a day, and that's going to help to have an easier labor all around. The 5th doula tip for prenatal is to sleep as much as possible. Believe it or not, your body is doing a lot during sleep, and so sleep is very important, especially for the growth of your baby and to reduce stress. Number 6, you want to rotate your hips as much as possible, and this goes along with the stretching and the squatting. You want to make sure that your hips are nice and limber the 9 months prior to your birth. Number 7 for prenatal doula tip is self-love, masturbation, self-pleasure, self-touch. Now, this might not seem self-explanatory. To me, it is self-explanatory because birth is a sexual act, and to prepare for birth, to prepare your womb and your vagina for birth, definitely self-pleasure is very important. Number 8, you want to drink tea every single day. You want to drink at least 2 to 3 cups of red raspberry leaf tea. This will help tone your uterus and prepare your uterus for birth. Number 9 in my prenatal doula tip is breathing exercises. Breathing actually increases your oxytocin, and learning to breathe properly is going to help your body actually prepare for labor, because in labor what you want to do is increase oxytocin. And so if you've been preparing before your birth on your breathing exercises and preparing your body to produce the oxytocin, you will be in great shape. And number 10 for prenatal doula tips is perineal stretches. You want to make sure that your perineum is as stretchy as possible to reduce the possibility of tears and to reduce the possibility of receiving an episiotomy, which is when the doctor cuts you themselves. Those are my top 10 tips for prenatal care. Now let's get on to the birthing side. So my top 10 tips for birthing. Number 1, you want to have warm compresses on the perineum, especially during the crowning phase. If you are going to have a midwife, most likely she will already do this for you. If you are a doula watching this, you want to have warm compresses ready. So what you can do is get some towels, some of those washcloths, and put them in warm water, and then you can pass it to the midwife so that she can do warm compresses on the perineum during the crowning stage and the pushing stage. Number 2 birthing tip, chin to chest. Some women don't like this, but it really helps you to focus and send all of your energy down and out, down and out. So you want to remember chin to chest when you're pushing. Number 3 for birth tips, changing positions often. Now, usually when we're in a hospital, we have a fetal heart monitor on us, so it makes it hard to move around. However, you want to be as mobile as possible. Moving the hips around really helps the baby to descend down into the birth canal, and changing positions can also jumpstart any stalled labors. Number 4 birth tip is inversions. So sometimes when the baby engages in the birth canal, he might get stuck or she might get stuck, and so doing inversions will help the baby engage, and then he can re-engage again in a good comfortable position, and the birth can go on. 5 birth tip is using an exercise ball and or a peanut ball. There are so many different positions that you can use this exercise ball for. You can sit on it to rotate your hips. You can lean on it to be on your hands and feet. Many different things you can use the exercise ball. The peanut ball can be used while laying on your side, and it'll help you to stay dilated and help your legs to stay open. Number 6 for birth is engaging your knees together. In order to create a bigger outlet in the pelvis, you can, instead of having your knees out this way, you can put your knees closer so that the pelvic outlet can actually open. And you can look that up online for some images. Number 7, snacking and drinking. I know that in the hospital they encourage you not to eat anything, not to drink anything. However, remember, you are basically running a marathon, and you cannot run a marathon without eating, without fuel, and without drinking water. So that's very important to have snacks and water at a birth. Number 8, resting when the contraction is over, resting when contractions have stalled. This is a plateau. This is your body giving you the chance to rest and to regain some energy for the next stage of labor. So make sure that you take advantage of breaks from the contractions. Number 9 for birth, privacy, dim lighting, silence. Very important so that the mother can focus, concentrate, and feel safe. Number 10 tip for birth is words of affirmation. Words of affirmation are extremely important, and they allow the mom to stay focused on her course and know that she's doing her breathing right, her pushing right. She needs words of affirmation in this time of uncertainty and where there might be a lot of fear and anxiety. You can be there to ease her anxiety. And that's my top 10 tips for birth. Now let's get to my top 10 tips for postpartum. Number 1, immediate skin to skin for mom and dad. A lot of times we tend to forget that the dad also needs skin to skin. And so when you see, if you're a doula, when you see that the baby is about to be born, you want to tell the dad to take his shirt off, because he needs to have skin to skin with the baby as well for at least 30 minutes to an hour. This is going to create a stronger bond between dad and baby, and mom, dad, and baby. Number 2 for postpartum tip, you want to have a warm blanket ready for when the baby comes out. So you can either put the warm blanket in the oven, you can put it in the dryer for a few minutes, or if none of that is available, you can tell dad to put the blanket inside of his shirt to keep it warm. Tip number 3 for postpartum is to have a peri bottle ready with some warm water and some witch hazel so that the mom can use it to go to the bathroom. The midwife will most likely want her to use the bathroom before she leaves to make sure that everything is working perfectly, and so having that ready is going to be make it a piece of cake. 4, and this tip is for an emergency. And so let's say you're a doula and you get to a home birth before the midwife and everything is happening really fast, and the baby is born, the placenta is born, and maybe the mom is bleeding more than you would like her to be bleeding. This is a tip I got from a midwife from one of my trainings in Tennessee. And she said that in order to stop the hemorrhaging right away, you can take a piece of the placenta and place it inside of the cheek of the mom. Just place it inside. She doesn't have to chew it or anything, and just let it sit there, and that will help to immediately stop the bleeding. Now, this is only for emergencies, and obviously you are going to want to have call the midwife or call 911 if she is bleeding out, because you're going to want to have her transferred into the hospital as soon as possible. Number 5 postpartum tip, setting up a steam station. So if there is no hemorrhaging postpartum, there's no blood pressure issues, there are no pulse issues, then the mom can actually start vaginal steaming the day that she's given birth, every single day consecutively for 30 days. And this is going to help her to stop bleeding faster. It's going to help her with any infection. It's going to help her heal. It's going to help her uterus go back to its normal size. It'll help with postpartum depression and so many other things. If you want to learn more about vaginal steaming and the postpartum, there is a 4th trimester study that you can look up online. I think it's called 4thtrimesterstudy.com. Number 6 postpartum doula tip is have Depends ready. Depend diapers. So most of the time women are given these humongous pads to use postpartum, and those are fine, but I find that it's easier and more comfortable for them to just wear Depends. So you want to have Depend diapers ready for her to use postpartum. And you also want to have some warm compresses and or some padsicles. Now the padsicles, there's many recipes online. It's basically a prepared pad. You open the pad, pour some witch hazel, pour some aloe vera, maybe some lavender oil, and then you freeze them. And these should be prepared before birth so that you can just pull them out postpartum. Number 7 postpartum tip, have the placenta bowl ready. Most women that have home births or birthing center births, they want to keep their placenta, and so make sure that the bowl is available so when the placenta's born you can just store it in there, put it in the freezer, and we can deal with it later. Number 8 tip postpartum, some stool softener and some hemorrhoid wipes or hemorrhoid cream ready. It's usually an issue with constipation postpartum, and so having a stool softener is a great option to make sure that that discomfort doesn't happen. Number 9 postpartum tip, you want to have prepared food so that once the mom has given birth and she's ready to eat, all you have to do is warm it up and bring it to her. Easy peasy. And number 10 postpartum tip, allow mom to rest. Make sure, if you're watching this as a doula or as a dad or even as the mom herself, make sure that you do not have visitors that first hour. You need to rest. It's gonna be such a sacred time, especially that first day, first hour, and so you really want to keep it intimate and small. And anyway, you're gonna be exhausted. You don't want to have visitors. You don't want to have all these people loud and, you know, wanting to carry the baby and be around the baby. So push off visitors as much as possible so that mom can rest. And that is all I have. Those are my top 10 prenatal, birth, and postpartum tips as a doula. If you have any questions, please email me info@offsetherbals.com. Bye.